For all the latest updates, subscribe to News 9.
As per a recent study, neurological complications of COVID-19 can include delirium, brain inflammation, stroke, and nerve damage. Delirium is an abrupt change in the brain that causes mental confusion and emotional disruption. The study, led by the research team at University College of London and University College of London Hospital, was published in the journal Brain. It identified one of the rare and fatal inflammatory conditions, which is known as ADEM. It appears to be increasing in prevalence due to the pandemic. Some patients in the study did not experience severe respiratory symptoms and neurological disorder. The sign was the first and main presentation of COVID-19. Joint senior author Dr. Michael Zandi briefed over the new study and said, "We identified a higher than expected number of people with neurological conditions such as inflammation, which did not always correlate with the severity of respiratory symptoms. We should be vigilant and look out for these complications in people who have had COVID-19. Whether we will see an epidemic on a large scale of brain damage linked to the pandemic, perhaps similar to the encephalitis lethargic outbreak in the 1920s and 1930s after the 1918 influenza pandemic, remains to be seen." The study provides a detailed account of neurological symptoms of 43 people aged between 16 to 85. They were all treated at National Hospital for Neurology and Neurosurgery, UCLH, and were either confirmed or suspected COVID-19 cases. The researchers identified 10 cases of transient encephalopathy, which is temporary brain dysfunction with delirium. This corresponds with other studies finding evidence of delirium with agitation. According to researchers, there were also 12 cases of brain inflammation, 8 cases of strokes, and 8 others with a nerve damage, mainly Guillain-Barré syndrome. Researchers confirmed that most of those with brain inflammation conditions were diagnosed with acute disseminated encephalomyelitis. ADEM is rare and typically seen in children and can be triggered by viral infection. The team in London normally sees about 1 adult patient with ADEM per month, but that increased to at least 1 per week during the study period, according to researchers. The virus causing COVID-19, SARS-CoV-2, was not detected in the cerebrospinal brain fluid of any of the patients tested. This suggests that the virus did not directly attack the brain to cause the neurological illness. Further research is needed to identify why patients were developing these complications. In some patients, the researchers found evidence that the brain inflammation was likely caused by an immune response to the disease. This suggests that some neurological complications of COVID-19 might come from the immune response rather than the virus itself. Based on the study, researchers confirmed that the previously reported findings of a higher than expected number of patients with a stroke results from the excessive sickness of the blood in COVID-19 patients.